And then at this point, I would check for skin turgor on the chest. I would pinch lightly, let them know they won't feel a thing, it won't be painful. And I'm just checking for dehydration. I want that to go back down. I went back down quickly, looks good. And then I would move on to the lungs. I would listen to those on the front and the back. And I would instruct the child that every time I place my stethoscope to take a really deep breath. So I will start with that. Okay, perfect. They sound clear throughout. I would then move on to the heart. I'm going to be listening to the aortic valve, which is on the right side, second intercostal space on the sternal border. I would be listening to the pulmonary valve, which is left on the left side, second intercostal space, sternal border. Then I would move down to the tricuspid, which is the left side, fourth or fifth intercostal space on the sternal border, and the mitral valve, which is on the left, fifth intercostal space, mid-clavicular line. I would listen to the apical pulse for 1 full minute, making sure that it's normal and there's no abnormalities. Perfect. And I time lapse that apical pulse. Once I've done that, I'm going to move on to the abdomen. I'm going to just start out by looking at the abdomen, making sure I don't see any bulges, any abnormalities, just looking at it. And then I'm going to move on to listening to it. I'm going to let the patient know that I'm going to listen to their tummy grumbles. And I would start at the right lower quadrant to the right upper, left upper to left lower. And you had active bowel sounds, which is perfect. Then I would ask the patient when their last bowel movement was. If they didn't know, I could ask mom. I would want to know if they're regular, if they're normal, any trouble or straining. And then I could palpate. I would palpate the abdomen for any tenderness, feel for any bulges, any abnormalities there as well. And then I could ask about the urinary system, ask when the last time the patient urinated, if there's any burning, any painful sensations, and again, if they're urinating regularly. And as always, I could ask the parent if the patient could not answer these questions for me. And then I would move down to the peri area. I would just be looking for any abnormalities. I would also remind the child at this time that not to let anybody do this unless their parent is around, if that's what they prefer. And then I could move on to the limbs. Could start with the arms. I would just start by feeling for the tone, any edema, crepitus, anything like that. And then I could feel the pulses. I'd start with the brachial, and I would do this bilaterally at the same time. And then the radial pulses as well, and they feel great. And then I would check for range of motion in all the joints. I want to know that the elbows and shoulders and wrists all have great range of motion. I would then ask to test the strength. I want the patient to push against me and pull me as well. And then I would also check the nails, make sure that they are correct color for ethnicity, and then I would check cap refill on all 10 fingers, and it's all brisk, it looks great. I could move down to the legs, and I'd pretty much do the same thing that I did with the arms, just feeling for the tone. We want it to be firm, feel the skin, make sure it's warm, any tenderness, edema, anything like that. And then I want to see range of motion again as well. And I would do the strength test as well. I want them to push their foot against me and then their toes towards them against me as well. Then I would feel their posterior tibial pulses and their pedal pulses. And then I would do cap refill on all 10 toes as well. And then I could move on to sensation. I would do sharp versus dull, and ask them to close their eyes and tell me if it's a sharp touch or a dull touch and where. And then I would ask the patient to turn over. I would inspect their spine. I want them to bend over so that I can make sure their spine is symmetrical and aligned. I would also check for any abnormalities or bruises, lesions, anything like that, just checking over the spine and skin integrity. And then I would ask my patient and the parents if they had any questions at this time, and if not, then I would let them know that I'd be back to check on them soon. And I would put the bed in the lowest position and make sure the call light is within reach. And that is it. Thank you so much.